guys, so I did my paper on speech disorders. And one of the first things that I discussed was the difference between speech and language. So language disorders is just your actual comprehending of what someone says to you, and then being able to formulate and create in your head okay, this is how I would like to respond to this comment that was made, or this is a comment that I would like to make. You create that comment in your head. And so a disorder with this would be not being able to comprehend what others are saying or create a response in your brain yourself. Speech, on the other hand, is what you audibly say out loud. So speech disorder has to do with your muscles and your motor issues and not being able to control these muscles to communicate audibly. Early intervention is vital for these children because about 40 to 60% who have speech and language disorders, they go untreated, and it is easier to deal with it the earlier it's caught, just about the same with any other disorder or disease. And if they don't go treated, then their literacy skills and their social communication will be affected later in life. Another one is childhood apraxia of speech, or CAS as it's more commonly known. And difficulty of speaking, while might not seem like a big deal, it is a big deal, and it can actually affect their literacy goals in the future. And this certain disorder, CAS, is set apart because there's no consistency to it, so it's not a consistent muscle or motor issue that's being affected. It's very inconsistent. So it's actually harder to treat, and there's no set right thing to do, but there are things like PROMPT, which is prompts for reconstructing oral muscular phonetic targets, and this just deals with touching different muscles on the face to try and get them active. And then minimal pair approach is when you try and get them to say words like sat and cat, so you're changing one sound to see how they cope with it. Residual speech disorders, this is another thing that they're not huge speech disorders, but they are present in the kid's life, but people don't think it's enough to do anything about it. And these can cause issues with students' phonological awareness. So they'll have issues with being able to understand different sounds and all the processing that goes with it. And by age 9, students should really have all of their speech down for the most part, at least all of their sounds. They compared people through all different walks of life, and those who struggled with speech disorders had a lot of trouble later in life with phonological processing. So students with residual speech really need help, and it should not be ignored. And things like non-word repetition, multisyllabic word repetition, spoonerisms, phonemic reversals, and elisions, these need to be taken seriously and cut out as soon as possible. In the classroom, as a teacher, make sure bullying isn't allowed. Don't ever interrupt them. Let them finish their sentences. Keep the atmosphere positive. Give them time to answer. Don't refrain from calling on them, and really, really encourage them to communicate both socially and academically. And as a speech pathologist, schools should report them so that a speech pathologist can be acquired. And a speech pathologist needs to recognize their frustration of the student and then be patient, never snap, keep the attitude encouraging and loving, work with small increments, don't overdo it, keep it small and short and attainable, and help them work up to things, and use different techniques like prompts and minimal pairs that we talked about earlier to help them with their speech.